So what is a systematic literature review? Probably a topic that I could spend a long time on as well. I think to start understanding this, you have to start with the term literature review, which any folks who have spent time in certain kinds of grad school, like I have, are intimately familiar with. It's a painful process, or at least it used to be before we had better technology tools for it. But literature review is simply the process of going out to the published scientific literature and seeing what's been written and learned about a specific topic of interest. And the reason you do this is really because when you're adding new research, when you're adding to the body and domain of scientific knowledge, you want to make sure that you're doing so in a way that builds on what everyone else has accomplished so far. You're not duplicating effort, you're not missing something, you're not contradicting something that's already been proven to be true or not true. That's why we do literature reviews in general. Now, that word systematic literature review, it changes the intensity of this process. A systematic literature review is specifically a process that is used as a part of pharmaceutical development in our context, that is answering a specific research question and has a whole bunch of research architecture and infrastructure around it. That starts with saying, let's define and write down the question that we're answering. Let's write a protocol that's going to describe the steps we're going to take to exhaustively investigate this question. Let's do that investigation in a very transparent, documented, referenceable way. Let's have multiple people check the results, maybe reduplicate some of the process so that we make sure we're all in agreement on both the process and its conclusions. And then let's make sure that we report all of this, again, in a standardized, consumable way so that everybody can access the outputs of the process. And this is something that's required by regulators at a lot of points in the drug development process. It's not something that can be taken lightly or just done in sort of a let me take a stab at it kind of way. It's quite complex, it's quite rigorous, it's quite resource intensive, and it's very different than you might think, just let's look around at some keywords for literature. It's the most rigorous, complicated, high intensity version of that process.